Obviously, our cold weather is back, and winter can, we know, pose a lot of threats to our health, especially for the elderly folks in our lives. So Dr. Jennifer Patterson of Family Care of Independence near Centerpoint Medical Center joins us now today. Talk a little bit more about that. Good afternoon to you.
Hi, good to see you.
Thank you for coming in. So if you had to narrow it down, and I know it's hard for you to do, but name one of the best precautions older adults can take during the winter months.
Well, I think aside from the flu shot, which we all know is so important this time of year for everybody, I think taking precautions to prevent falls when it's slippery. We're talking about winter weather, snow, sleet, those sorts of things. Just takes a slight coating of freezing rain on a sidewalk or front porch, and our elderly can go down and have pretty serious injuries because of that.
Okay, so how can we best help the aging folks in our lives prevent that and prevent other things like the frostbite or even hypothermia?
Well, like Lisa said earlier, bundling up, making sure we're wearing layers when it's cold outside. Gloves, hats, scarves, especially if you have COPD or lung disorders. Putting that scarf over your mouth and nose can really help prevent those flare-ups from that cold wind. Making sure we wear proper footwear, good non-skid shoes.
Make sure they have that proper footwear.
Make sure they have that proper footwear. And then not forgetting that when we come in from the wet condition outside, we track that water into our house. So having a good rubber-backed mat that's not going to slip and slide to wipe off our feet, maybe even having a straight-back chair near the entryway that you can sit down and remove those wet clothes and wet boots so you don't slide.
We know this won't be long before we see scenes like this again. Yes. But you know what? Scenes like this, we're talking about the physical problems that come along with it. Let's talk about some of the emotional problems too that aging folks deal with, especially it seems during this time of year, more of the depression that comes with it.
Yeah, it's a huge problem that I don't think it's talked about very often. Days are shorter as far as the daylight hours. It gets pretty dreary out there.
It just seems gloomy.
You get stuck inside because you don't want to go out in the wintry weather. You don't want to fall. So making sure you check in on loved ones, especially the elderly. Stopping by, have a visit, make a phone call. For our seniors who are watching, who have church buddies or community center buddies, create a phone tree, check in on each other, give a call, make sure that you're doing okay, especially if there's a bad storm coming in.
Even that phone call can help the day go by a little better.
It does, very much so.
Now, what does diet play in all of this? Emotionally and physically too, keeping you healthy enough during these times.
Right, I think making sure you eat a wide variety of foods, getting those vitamins in. During the winter, it can be a little bit tough. We tend to eat less variety during the winter. Fresh produce, even though it's available, thankfully, does tend to be more expensive, so we eat less of those fresh fruits and vegetables, but they're still very important, and we need to make sure we're getting those vitamins in some way, especially vitamin D through our dairy products or our fatty fish.
Yeah, that's a good point. Very few of us, I'm sure, getting much vitamin D from Mother Nature these days.
Exactly.
Dr. Patterson, thank you, as always, for stopping by. To learn more from HCA Midwest Health, you can go to KCTV5.com and just click on our Health tab. Thanks again.